আসসালামু আলাইকুম বন্ধুরা, আপনারা দেখতে পাচ্ছেন physio24.com এর নিয়মিত লাইভ শো শামিম লাইভ। আর আমি ফিজিওথেরাপি চিকিৎসক শামিম হাসান রয়েছি আপনাদের সাথে। বন্ধুরা, প্রতিনিয়ত আমরা যেমনটি হয়ে থাকে, আমরা সারা পৃথিবীর বিভিন্ন জায়গা থেকে আমাদের সঙ্গে আমাদের অতিথিরা জয়েন করেন, আমরা কথা বলি বিভিন্ন গুরুত্বপূর্ণ টপিকস নিয়ে। তো আজকেও আমরা সেরকমই একটি খুব গুরুত্বপূর্ণ একটি টপিকস নিয়ে কথা বলবো, সেটি হলো যে কমন স্পোর্টস ইনজুরি। স্পোর্টস ইনজুরি তো একটি কমন ব্যাপার, আমরা জানি যারা খেলাধুলার সঙ্গে যুক্ত, যারা একটু খেলাধুলা করতে পছন্দ করি, তারা প্রায় এই ধরনের সমস্যায় পড়ি। এমনকি অনেকে কিন্তু আসলে কি প্রফেশনালি খেলি না, কিন্তু হয়তো বা খেলতে পছন্দ করি। কখনো এই যেমন ছুটিতে অনেকে বাসায় বসে হয়তো ঘরের ভিতরে ইনডোর কোনো গেম খেলছেন, সেখানেও পড়ে গিয়ে ব্যথা পাচ্ছেন। দিস অলসো স্পোর্টস ইনজুরি। তো আজকে সেই স্পোর্টস ইনজুরি বিভিন্ন বিষয় নিয়ে আমরা কথা বলবো। আর স্ক্রিনে দেখতে পাচ্ছেন আমাদের অতিথি আজকে যুক্ত রয়েছেন ইতিমধ্যেই। আমাদের অতিথি হিসাবে ডক্টর মায়াঙ্ক পুষ্কর নিযুক্ত আছেন ইন্ডিয়া থেকে, এবং যিনি লিপসাইট হেলথ কেয়ারের চাইল্ড ট্রেনার হিসেবে রয়েছেন এবং অ্যাজ এ ডাইরেক্টর। সো আমরা তার সঙ্গে আজকে আসলে এই স্পোর্টস ইনজুরি গুলো নিয়ে অনেক গুরুত্বপূর্ণ কথাগুলো বলবো। তো যারা আসলে আমাদেরকে দেখতে পাচ্ছেন, যারা আমাদের সঙ্গে যুক্ত হয়েছেন, তাদের যদি কোনো প্রশ্ন থাকে অথবা কোনো মতামত থাকে বা কোনো জিজ্ঞাসা থাকে, তাহলে ডক্টরের কাছে জানতে চান যদি কোনো কিছু, তাহলে সেটি কমেন্ট বক্সে লিখে জানান, তাহলে আমরা সেই প্রশ্নটি দেখতে পারবো এবং সেই প্রশ্নটির উত্তর দিতে পারবো। সকলকে আবারও স্বাগত জানাচ্ছি, আমরা চলে যাচ্ছি আমাদের উপস্থিতির কাছে। ডক্টর, ওয়েলকাম টু physio24.com.
Thank you so much, sir. It's my pleasure to be here.
Yeah, thank you for your giving me for your time. So, what is the common injury in the sports field?
Thank
Hello.
you.
Can you hear? Hello.
See, if first of all, I would like to thank the team Physio News 24 of Bangladesh, and I would like to thank Dr. Shamim and Dr. Santanu, who is one of my friends since long time. It's my pleasure to be here on this platform. Okay. And today I'm going to talk about some of the common injury associated with sports.
Yeah. Doctor, can you hear me?
Yes, I can hear you, sir.
Yeah. Then, as a sports physio, then what is the common injury in sports?
Okay, can you just repeat the question again, because there was some disturbance in the network?
What is a sports injury and what is the common injury in the sports field?
Okay, so first of all, talking about the sports injury, any injury, okay, which happens on field during the event or before the event, during the trial session or during the training session, any type of injury which occurs, we call it as a sports injury. Usually these sports injury are associated with most of the time it's like a musculoskeletal injury. If you look into the daily practice, it will look like a musculoskeletal injury. The most common type of sports injury will be, like, you can say that a sprain or a strain. A sprain is the ligament strain, you can say, and a strain that might be for the muscles or the capsules or tendons, you can see. Then we have got any recurrent injury like ACL reconstruction, ACL injury. We have got the most common in the knee. Then if you are talking about the tendon-Achilles, the rupture is one of the very common injury again. Then might be a stress fracture or fracture. If you are talking about the games like cycling, in that if any injury happen, most of the time it will be a clavicular fracture. So depending on the game, and dislocation is also one of the very common injury during the sport. So like most of the time, these are the most common injury. But if you are, then again, it depends on the games to game. Like at present, I'm working with the like Indian martial art team. Okay, and in during the mixed martial art game, usually if they are playing self defense and other technique, they don't have much. They don't get much injury. But whenever they are playing with a mixed martial art team, it's freestyle martial art. In that, you will see that there might be injury of the like mandible injury, or like bleeding can be there, contusion can be there, bruises can be there because of the hit made by other compartments. So these are the common like type of injury during the sport.
Yeah. Then after any type of sports injury or any type of injury, why you can use icing? What is the benefit of icing?
Okay, so coming to the icing, it is one of the common tool, basic tool for our sports physio. Okay, along with the icing, we use taping as well. But icing is one of the basic tool for our sports physio, for our physio like us. The main benefits is like it immediately reduces the inflammation. Okay, it increases the vasodilation. Then it will decrease the pain. It will decrease the swelling. It will also decrease any soreness of the muscle, or all of a sudden if any injury got, if pain or strain got happens, then it can reduce the inflammation, sudden inflammation reduction as well. So these are the some of the like importance of like uses of icing. Even it can help in the inflammatory response, reduction of inflammatory response as well. So these are the some of the benefits of cold therapy.
Yeah. Then what type of technique you use for treat the patient immediately to recover this injury?
Okay, let's see. Treating a patient on field or off field, or treating a patient in clinical setup is completely different, because in clinic, whenever we are treating the patient, we have got enough of the time to treat the patient. So it's like whatever you are doing, you can just think, you can decide, you can then ask the patient whether they are comfortable with that treatment or not, and then you can plan your treatment plan. But treating on field is something different. What it happens, we have got the most important thing in the sports management is the time management, you can say. If you have managed the time, because you will be having, while any game is going on, during the game on field injury, you will be having 2 + 1 minute. That means 3 minutes only to treat the patient. Okay, not only treat the patient, you have to like assess the patient. Okay, then plan out your goals of the treatment, and then treat the patient and come back off field. If you are taking longer hour of time, longer time, than that athlete or that player might get some negative points. So that is the basic thing. So which we have to first think. Okay, what treatment technique we are using. So whatever treatment technique we will use, that should be like very quick and effective. So basically on field nowadays, what we are using is if any injury is there, like we use icing. Then for the support, like injury support or support to the joint or support to the muscles or ligaments, we use taping, which is widely accepted and most common like sports injury management tool, you can say. Taping. If anyone is a sports physio, if they don't know taping, then you can say that, okay, you don't know anything. So it's the common thing. So taping, then after like post injury nowadays, like even cupping and dry needling is getting very famous, and we are using cupping and dry needling post injury off field a lot. Stretching, again, coming to the basic things of our traditional physiotherapy, that is stretching is one of the again most important treatment tools during the on-field injury. Sometimes the patient might get cramp, or sometimes the patient might get all of a sudden locking tenderness of the calf. That time stretching helps a lot, because when you will do the stretching, that time immediately there will be increase in the blood circulation around that area, and it will decrease the pain and tenderness or locking of the or stiffness of the muscle. So we use this technique. But nowadays, like cupping is also getting very popular on field. Like we are using dynamic cupping because it saves our energy and saves the time of treatment as well, and it has got the deeper effect. So we use all these techniques nowadays. Like even my facial release, we are using. It's just like same like you can say kind of a stretching but different technique. So we are releasing the fascia. So for releasing the fascia, again, we have got different tools available. Like we have got the instrument assisted soft tissue mobilization ISTM tool. Then we have got Gosa therapy, which is commonly used in China and Bangladesh and all. Okay. And then we have got cupping is also used for the soft tissue release or like myofascial release. So these are some of the techniques we use on field and off field for the sports injury management.
Then which type of cupping use the on field and immediate for the immediate result?
Okay, usually like on field we use dynamic cupping for the immediate result because we cannot use a static because static use of a static cupping it takes lots of time. But the dynamic cupping, what it does, it helps in many ways. Like it might like stretch your muscles, it loosen your fascia. So basically, dynamic cupping or moving cupping, you can say, is more effective on field or during the sports injury management.
Then you say that tapping. Tapping is also used for sports rehabilitation or injury. Then which type of tapping or tape, kinds of tape, which type of kinds of tape are used in on field, and what's the technique?
Okay, so coming to the taping again, it's a very vast topic. Okay, we have got not only the kinesiotaping, taping, we have got almost like 10 till 12 types of different types of taping, which we use during our practice. So it's nothing like that. We use only kinesiotaping. Taping. We have got the most important tape. We have got like athletic tape or a sports tape. That is the rigid tape we are using whenever there is any injury. And when we have to restrict the range of motion, that time what we do, we use the rigid tape, which completely or almost like restrict 100% of the movement of the joint. So the athlete or the patient will not able to move that joint and it will give a complete support to that area. But whenever it comes to the, like you can say, on field, that time we prefer to use kinesio tape because the main characteristics of kinesio tape is what it does. It has got the properties of elasticity because you can stretch that tape. So it just gives little bit support to the injured part, little bit support to the like a strain or sprain area, but it will allow the movement so that the athlete can play effectively. It will not restrict their movement while playing because there is no use of there is no use of using any technique if the player is not able to play well. So we are using this taping just as a like supportive treatment in order to treat the like athlete, and it will give us support and allow the movement. Kinesio tape we are using on field mainly, but coming to the rigid tape we are using off field. Most of the time you will see that when there is an injury on field, that time you might have seen that a sports physio is running with the colorful tape that are the kinesio tape. Once that patient comes off field, like once the athlete or the player have finished their you can say their games, then they come to off field. That time if we see that okay that the player might need complete restriction of range of motion, that time we use the rigid tape and it will restrict the range of motion. Other than that, we have got so many other types of tapes. Like we have got the cohesive tape. It is just an advanced version of, you can say it is just an advanced version of strap bandage with the adhesive in it, and you can reuse that tape again and again on the same patient. Okay. we don't recommend to use that cohesive tape on other patient with the same tape. Then we have got the fingertips again for the smaller joints. Then we have got nowadays like biomechanical tape, that is dynamic tape. It has got 4-way stretch tape. Okay. So these are some of the types of tapes we have got in the market. Like nowadays, like even waterproof kinesio tapes are available, synthetic tapes are available. So even for the rigid tape, we have got the white rigid tape, then brown rigid tape. So some of the kinds of tapes are, these are some of the kinds of tapes available, which we are using it.
Sometimes sports physio also use needle, that dry needle. Then what is the difference between dry needle and acupuncture?
Okay, there is a great difference between the dry needling and the acupuncture. The basic thing, the only similarities is like the needle which we are using it during the dry needling and acupuncture. Only the similarities between both is the needle which we are using it. Rest other thing is completely different. If you are talking about the dry needling, it is completely based on the modern medicine. Okay, it works physiologically, it works on anatomically, it completely works on the pain gate theory and healing theory. But if you are talking about the acupuncture, it works on the hypothetical theory, that is future energy flow, that is traditional Chinese theory. Okay. They have got the hypothetical point, that is, they say that it works on the meridian point. Those meridian points are completely hypothetical. There is no justification in it. But in dry needling, we are using with the justification. You can justify it why you are treating these muscles. We are using dry needling on the myofascial trigger point. So in order to treat the patient on the with the dry needling, what we do, we first do the manual palpation, then go for the pain reflector in order to find out the dermatomes and myotomes of that pain, then try to correlate with our diagnosis whether those muscles are affected, then try to find out the active trigger point with the like palpation. The palpation can be two types, flat or pincer. So once we got the active trigger point, then only what we do, we insert the needle over there. So it's complete difference between the acupuncture and the dry needling.
Yeah. Then we got many questions. And we got a question: how many approaches can be used on field?
Just 1 second. Let me see the question. I'm not able to see that. Okay. Just 1 second. Huh? Just where can I find the questions? Live comments. Okay. So okay, so there's like some questions by Dr. Santanu Malik, right?
Yeah.
Like how many approaches can be used on field? Okay, mainly like we have got the limited approach to use on field, like you can see cold therapy, then the pain relieving spray. You can use any diclofenac spray or any type of spray, Coolax or Biofreeze or anything, depending on whatever it is available with you. Then we have got taping is one of the common. Then common stretching or myofascial release. We are doing sometimes nowadays. We are doing on field even the needling as well, and obviously cupping. So almost like 5-6 technical approaches we have got on field, not much. So we cannot use our electrotherapy, or we cannot run with our electrotherapy machine on field. So that is very difficult. So we are using all these 4-5 types of approaches on field.
Yeah. Thank you. And another question from
there's another question. Yeah, recent advance of the sports physiotherapy. Before that it was the main recent advance is, you can say that before that it was a price therapy, but nowadays, okay, before that it was a rice therapy, right? But nowadays we are using, later on it came to price therapy, but nowadays we are using pricer. It's not rice, it's not price, it's prices. So what is that? The pricer is P stands for prevention. That means pre-injury prevention, you can say. Then R is for the rest, I is for icing, okay. C is again for the compression, E is elevation, and R is the referral. Because most of the time, what you will see, if you are talking about the sports injury, there are so many life-threatening emergencies are there. So in that case, what you have to do, you have to check for the few of the components which you have to check, like you have to check for the airway obstruction, then respiratory problem, then cardiac arrest, severe head injury. There is, you have to look for any severe head injuries there. Then any cervical spine injury, you have to look for. Then any severe bleeding. In those cases, it is beyond the physiotherapy practice, like not beyond the practice, but what you have to do, you have to decide and you have to refer those patients to the for the medical health. So this is mainly the recent advancement in the sports injury management. You can say that we are using as pricer technique. Okay.
Then price technique is also only for the health professionals, I think.
Pardon, sir? I didn't get you. Can you repeat the question again?
Yeah. Price technique also used only for the health professionals or physical therapy. Yeah.
Yeah, like price we are using in our clinical practice, but for you can say nowadays recent trend we are using is price in a sports.
Can you get? Doctor, can you hear me? Hello? Hello? Can you hear me?
I think there was some network issue. Can you hear me? Dr.
Yeah.
Shamim?
Yeah. Got it.
Okay. So yeah.
We got another question. The main goal of a physiotherapist when a athlete's injured.
Yeah, what is it? There is a question by Mustafa Rashid. What is the main goal for a physiotherapist when an athlete is injured? The main goal of physiotherapist, the first thing is that you have to check for the life-threatening emergency situation. See, that life-threatening emergency situation can be the airway obstruction, then you can say respiratory failure or cardiac arrest, sometimes severe heart injury, then head injury can be there, severe bleeding can be there. Once you have like check those things, okay, if those things are clear, after that your goal will start for the basic management of the patient for the sports injury by the physiotherapy. If there is anything related with the above said things, then you have to immediately refer that patient to the medical help. Or else what you can do, you can start your treatment. You can start managing that. The first thing what we do, we use the spray, which is basic things. If there is any localized strain or sprain, we use the localized diclofenac spray or pain relieving spray, anything. After that, we use the taping. Then after that, we use e-icing or stretching, you can say, because why we are using ice, because most of the time we make mistakes that we use ice than we apply the tape. But usually we say that, okay, we should not apply the tape when our skin temperature or body temperature is altered. It should not be very cold, it should not be very hot. It should be at the body temperature area. Once you have applied the tape, after rubbing the tape, because the kinesio tape has got the heat activated adhesive. So what we have to do, once we have rubbed the tape, after that you can apply the cold therapy. So this is the basic goal. The main goal, you can say, is the reduction of the swelling, pain relief, and giving stabilization to the area where there is an injury, so that the further injury should not happen. There should not be any further injury to that player or that athlete. So this should be the main goal.
That's the main goal. Yeah. Thank you, Doctor. And another question is, what is the police means in equate management? What is the police means in equate management?
Okay, so police is again the prevention than observation. Okay, icing, elevation, compression, icing, compression, and elevation.
Yeah.
Any more questions by any of the?
No. থ্যাংক ইউ ডক্টর। যারা আমাদের সঙ্গে যুক্ত আছেন আসলে সকলকে অসংখ্য ধন্যবাদ জানাচ্ছি যে আমাদের সঙ্গে যুক্ত থাকার জন্য। এবং আসলে আপনার যদি কোনো জিজ্ঞাসা থাকে, কোনো প্রশ্ন থাকে, তাহলে ঝটপট সেটি লিখে ফেলুন। তাহলে যেহেতু আমরা আসলে এখনো যুক্ত আছি, আমরা কথা বলছি, আমরা চাই আসলে এই আপনাদের অংশগ্রহণ দিয়ে প্রোগ্রামটি আরো প্রাণবন্ত করতে, কারণ আপনাদের প্রশ্ন, আপনাদের জিজ্ঞাসায় কিন্তু অনুষ্ঠানগুলোকে আরো প্রাণবন্ত করবে। আদারওয়াইজ আসলে আমরা নিজেরা কথা বলে হয়তোবা কিছু টপিকস নিয়ে অনেক সুন্দর সুন্দর গল্প হবে, কথা হবে, তো তার থেকে বরং আসলে আপনারা কি জানতে চান, আপনাদের কি জিজ্ঞাসা রয়েছে, সেটি লিখে পাঠান, তাহলে আসলে আমরা সেগুলো নিয়ে আরো কথা বলতে পারবো। দেন I think Dr. No question.
Yeah, so thank you so much everyone, and stay safe, stay at home, be safe, take care of yourself and your family, keep on learning. Okay, if you need any doubt, you can contact me on the WhatsApp or Facebook or Twitter. It's my ID is Physio Mayank, PHYSIO MAYANK, and you can take down my WhatsApp number. It's the Indian number. It's +91 9162 93 112. It's +1 +91 9162 93 112. So thank you so much, Dr. Shamim and Dr. Santanu, and I'm really grateful to the Physio News 24 Bangladesh. They have given me the opportunity to talk about the common sports injury today. Okay? Thank you so much, everyone.
Thank you so much, Doctor. এবং সকলকে ধন্যবাদ জানাচ্ছি আমাদের সঙ্গে যুক্ত থেকে আসলে এই প্রোগ্রামটি আনন্দ ঘন এবং আসলে সাফল্যমণ্ডিত করার জন্য। সকলে ভালো থাকুন, সুস্থ থাকুন, আর আমাদের পরবর্তী প্রোগ্রাম দেখার আমন্ত্রণ জানিয়ে এখানেই শেষ করছি। আল্লাহ হাফেজ।